Hey guys, I want to talk to you today about the knee. Sports are going to be starting soon, and we all hear the horror stories about ACL tears and different types of knee injuries. Listen, we can't totally prevent these injuries from happening, but we can absolutely reduce the risk of them happening. Through proper training, your off-season training, you can absolutely reduce these things from happening, especially from a non-contact standpoint. When we talk about the knee, we have to remember what the main job of the knee is, right? The main purpose is to stabilize this leg. So a lot of things have to happen up chain and down chain on this leg. We have to have good muscle activation in our hips. We have to have good ankle mobility activation, different things like that, where this knee has to compensate even more. And then we'll run into other injuries or even a greater risk of knee injuries happening. The other thing when we talk about the knee, we have to remember that the knee is not a bony structured joint, right? So we have bony structured joint, and then we have more of a soft tissue based structured joint. When we talk about bony structured joint, we use the hip as an example because the femur has a ball on it, right? And it goes into the hip. And what happens is there's about 70% of surface contact, right? So it's a stable joint. It's going to rely a little more heavily on mobility, but it's going to be stability in nature because of the surface contact. When we talk about the knee, the knee relies a little more on soft tissue and muscle activation for stability, right? So we're already at a risk when it comes to that. So stability is going to be a big thing for us. The other thing with the knee is that it's really relies a lot on dynamic stability. Not so much just standing stability, more of dynamic. So if I go to change direction, land from a jump, this is where we tend to see these ACL injuries because this knee relies heavily on the dynamic stability. And when we talk about ACL injuries, we know that they happen within that first 20 degrees of knee flexion, okay? And when I'm playing a multi-directional sport, I'm changing direction, I'm making cuts, I'm accelerating, I'm decelerating. I'm going to go anywhere from 50 degrees all the way up to, upwards of 90 degrees of knee flexion. So if I go to make a cut and I stick this leg in the ground, I'm definitely going through that first 20 degrees of knee flexion where, we can tend to run into these ACL injuries. So, the biggest thing that I can tell you is you want to own that first 20 degrees of knee flexion. Right? So, and you can prep for this through your training. Now, I'm not saying your training has to consist of, a rehab session every time or a physical therapy session where all you're doing is working on knee corrective exercises, different things like that. You can absolutely do this through, proper training in your sprints, acceleration, deceleration, jumping. Landing from a jump is the most important, again, because this is where we're going to kind of run into this first 20 degrees of knee flexion. And this is where these ACLs, kind of happen, right? The other thing that we see when people are jumping and stuff, they get into this knee valgus where these knees come in. Listen, not only is that going to happen when they go to jump, but when they land too, this happens as well. And we know this is like the ACL no-no, right? That ACL doesn't like that tibia rotation because this is where it's going to shear that ACL. And then we end up with a possible ACL injury. So we want to make sure that we're owning these positions, we're owning these first 20 degrees of knee flexion, through the proper training. Listen, I said it before, you cannot totally prevent these injuries from happening. If anybody tells you that they can prevent this stuff from happening, they're lying to you. You can absolutely reduce the risk, through the proper training, but we can't totally prevent these. But through smart training, we reduce this risk dramatically.